Hello and welcome back to the channel, unless of course this is your first time watching one of my videos, then in that case, just welcome. I'm Rob Long, and in today's video we're going to take a look at the various ways you can get started in the medical profession quickly and for not a lot of money. There are a lot of jobs you can get in the medical field that don't require you to take years and years of schooling and accumulate a mountain of student loan debt to achieve. In this video, we're going to go over 6 different medical careers that you can start in a year or less. And here they are in no particular order. Number 1, Certified Nursing Assistant, or CNA.
What is a CNA and what do they do?
Good question, computer-generated English guy. CNAs are primarily responsible for the basics of patient care, such as helping the patient in and out of bed, eating, and ensuring the patients are taking their medications. They may also be responsible for the patient's personal hygiene and monitoring the patient's vitals and informing clinical staff of any changes. For bedridden patients, they may be responsible for shifting the patient's body position to avoid bed sores. You can find CNAs working in nursing homes, home health care settings, and in hospitals. How long does it take for someone to become a CNA, and how much do they make? Well, most CNA programs only last between 4 and 12 weeks, and the national average salary for CNAs as of 2022 is about $16 per hour. Number 2, Patient Care Technician. Patient Care Technicians, or PCTs for short, are pretty easy to sum up because a lot of the similarities they have with a CNA as far as working environments and job description. Except that patient care techs have a larger scope of skills. They do everything a CNA does, but they can also usually draw blood and perform EKGs, for example. As a result, the schooling is more involved and can take 6 to 8 months. But note that in most cases, you have to be a CNA first before you can start a patient care technician program. As of right now, the average wage for a PCT is around $17.25 an hour, but that can vary wildly just due to the setting and from state to state. Number 3, Certified Medical Assistant. Medical assistants generally have a very broad skill set, including patient triage, phlebotomy, EKGs, injections, administering skin TB tests, drug and alcohol screenings, physicals, breathing treatments, suture removal, assisting the providers with procedures such as INDs and wound dressings. They can be found working in a very wide range of settings, such as urgent cares, private physicians' offices, specialty offices like wound care clinics, cardiologists, dermatologists, ear, nose, and throat doctors. The list really goes on and on. Most MA schools last between 6 months and a year, and the average hourly wage is approximately $17.75 an hour. The pay moves up approximately to about $20 an hour if the MA gets the add-on license of limited scope X-ray operator. Check out my video about limited scope X-ray for more information about that. The link is in the description. Number 4, Emergency Medical Technician, or EMT. EMTs are mostly known by the misnomer ambulance driver. Basic EMTs are responsible for patient transport and are trained in BLS CPR and monitor patients' vital signs, obtain patient medical history, assess the patient's condition upon arriving on an emergency scene, and can perform EKGs and administer oxygen. Where can you find EMTs? Well, usually on an ambulance. Although some urgent cares will actually hire EMTs to work as part of the clinical staff and do some of the workload that medical assistants do. Note, there are different levels of EMT, each requiring additional training and having different pay scales. Here we're just discussing the basic EMT. Most basic EMT training takes between 6 and 8 months to complete, and the average hourly wage as of 2022 is about $16.75 per hour. Number 5, Surgical Technologist. Just as the name implies, surg techs are usually found in operating rooms. Their job responsibilities include, but aren't limited to, passing instruments to the surgeon, setting up the OR for the procedure with all of the proper instruments, holding retractors, maintaining the sterile field, and working under the added pressure of needing to know the steps involved with a particular operating procedure so that way they can anticipate what instruments to hand to the surgeon at a moment's notice. Although you can become a surge tech via an associate's degree, here we're just going to take a look at the time it takes to complete a certificate program at a vocational school. In general, it will take 1 year of full-time study to complete the surge tech program, and the average pay is around $23 per hour. Compared to everything else on this list, surgical technologist is probably the most difficult due to the fact of the schooling being full-time. Generally 5 days a week, so trying to maintain a full-time job while going to school is probably not going to work for a lot of people. But on the flip side, it's also the highest paying job on this list. And that brings us to number 6, phlebotomy technician. The one that patients usually fear the most is the phlebotomist. They are responsible for drawing blood and processing specimens for testing. The fear of needles, or trypanophobia, affects nearly 1 in 10 adults and is one of the challenges of being a phlebotomist. Not only do you have to effectively calm the patient, you also have to hit the vein in the first try to avoid making the experience even worse for them. You can find phlebotomists working in clinics, hospitals, and donation centers. In contrast to surgical technologists, phlebotomy tech is probably the fastest way to get into a hands-on clinical medical job. Most schools only take between 2 and 3 months, and the average salary is about $17 per hour. There are other good medical careers out there that don't take much time to get started in, but that will have to be another video. All these jobs can be very rewarding and can be a very good starting point for possibly a lifelong career in the medical field. Some of you may be wondering why LPN is not on this list. Don't worry, that's going to be getting its own video in the future. Some people decide that they want to be a RN from the get-go. Others decide they want to go to medical school while they're still in high school. And some may work decades in retail only to decide one day that they want to change and they want to go to school to be a physician's assistant. But what happens if after going to school for 3 to 8 years, you don't actually like the medical field? This happens to a lot of people. I would suggest to anyone to get a medical job as a phlebotomist or CNA or patient care technician first. In some cases, you can complete your training and will be working in as little as 3 months. You could work for the next 6 months to a year just to test the waters and see if you hate working in the medical field or you actually do love it. At least you'll know what to expect before spending years of your life and a huge sum of cash going to school. Although it may not be easy to get your foot in the door, there may be opportunities to shadow an MA or an RN for the day just to see what a day in the life is like. That takes practically no time and $0. You just have to do your own research and contact every medical facility you can and ask if you can shadow for the day. The bottom line is you can start a career in healthcare without a huge commitment of time or money. Hopefully this video helped you, and if it did, don't forget to give it a thumbs up. That helps out the channel a lot, and subscribe for more content just like this. Until next time, I'm Rob Long, a medical guy. Thanks for watching.